one, roll the footage. Welcome everybody to the Strategy Show. I'm your host, Simon Severino. Today with us, Vice President of Venture Investments at Leaps by Bayer, ex-CEO of CytoSen Therapeutics, co-founded Exonics Therapeutics, medical degree from Stanford, board member at Century Therapeutics, Triumvira Immunologics, Pyxis Oncology, and Metagenomi Technologies. Welcome everybody, Jak Knowles.
Hi everyone, nice to see you all.
What a list, man.
Yeah, thank you. Yeah, I forgot one, Century Therapeutics. We just launched a month ago, so one more board seat at least for now.
Congrats.
Thank you.
Congrats. And what are you currently creating?
So I work with Leaps by Bayer, which is Bayer's corporate venture arm. We are really focused on next generation technologies, both in human health and in crop science. I've done deals across, crop science, consumer health, therapeutics. But right now I'm really focused on next generation technologies. So cell therapy, gene editing. I think these are the modalities that are really going to take us into the 21st century and beyond.
Beautiful. And you have brought 3 CEO tips for our audience. The first one is that people need to be first. The second one, we will see why having a collective mission matters. And the third one is about raising more money than you think you need. But before we go there, we move to the segment of our show that we call the Strategy Award. If you could pick just one company that is doing things differently, but from your point of view, they are doing the right thing, who would that be?
Yeah, so I'm going to go with one of my own. I think Century Therapeutics. This is a cell therapy company. We started with Versant Ventures and Fujifilm CDI as our manufacturing partner. Really big Series A, $250 million. And they're going after a big area of unmet medical need, which is cancer. But they're doing it in a really novel way. So instead of using autologous cell therapy, which is a patient's own cells, they're taking a pluripotent adult stem cell called an iPSC and using that to make their therapeutic. So what this will do is enable basically a consistently renewable source of new therapeutic cells, all from a single clone. And that allows you to do a lot of gene editing, a lot of manipulation of the cells to really come up with the perfect cell therapy.
Beautiful. So how old do you think are we going to get?
I think probably, so I'm 41 and I look really young. I think that people that were born, I was born in 1979, I think in the early 80s to 90s, the average life expectancy should go up. I think people that are alive now, there's probably someone that's living on the planet that will live to be 130, 140 years. So, I don't know if I'll get there, but I hope to at least get to 80 or 90. And I think that would be a happy life in my view.
Will our kids become 200, 250?
I think there's some limits there. I think, the big killers are cancer, obviously, and heart disease. And then I think we all have to be a little bit aware of this. The human brain isn't really built to last that long. And so we see all these problems now with dementia, Alzheimer's. And so you have to really think about the quality of life. So just keeping a human being alive to 200, it might be possible. But, those last 100 years, you might not be feeling so great.
So the bottleneck is the brain. Interesting.
Yeah, I think so. From a certain perspective, I think heart disease and cancer are the two things that will kill you. But I think the biggest impediment to living a full life will be the ability to maintain your mental cognitive ability. So even if you can keep the body healthy and alive, is your brain going to be capable of really having a high quality of life past a certain age? I don't know. But I think a lot of the things that we're doing to our bodies, whether it's drinking, smoking, lack of exercise, all of these things have been shown to impact mental health later on in life. So, we might be able to physically get you there, but mentally, you have to kind of be an active participant in maintaining your own mental health.
Absolutely. People in the comments are saying hi, hello Ashley Curtin, hello everybody. If you have questions, just chip them in and I will ask Jack. So let's go to the first CEO tip, which is people first.
Yeah.
More about that.
Yeah, a while to learn this one. I've come from a science background, as you mentioned. I'm an MD by training, and I always tend to look at the technology and the intellectual property as being the foundation of any company. But I've seen over my career, those things are important, but what really matters is the team that you build. Frequently, the first version of a technology doesn't work. You need to make changes. Sometimes you have to pivot entirely into a different therapeutic area. And so if you have the right team, the right people around you that can be flexible, that can be thoughtful, that can help steer a company in those kind of dramatic change situations, that can really make all the difference. So I really like to surround myself with the best people, people that have track records, that have done this before, but also people that are open-minded, free thinkers, really thought partners. I don't know if we're allowed to use bad words on this show, but I try to have a no asshole policy in all my companies and make sure that, we're all pulling in the same direction. I want people to really want to work together and to feel good about sacrificing and working for the common good.
We have two different kind of schools here in the strategy show. We have some people who say, like you, but also Jim Collins and others that say people first, then you have the bus, you have the seats, and then you decide where the bus is going to go because they will do it. And then we have the second team and the second school of thought, which says people are absolutely irrelevant to an organization. Systems are everything. You need the processes, you need the systems, and then the system will repair itself, kind of like the body cells doing their work and then, putting things out and in as needed. You seem to be from the people school.
I'm definitely from the people school. And again, this is, me learning through several CEO experiences at this point. I just think, I forget who said this, but culture eats strategy for breakfast. I think it's really true. And the people are what define the culture. If you have good people that are pulling for each other, those are the organizations that stand the test of time and that can, weather some tough circumstances. Having the best strategy, having the best plan. My favorite quote from the boxing world is from Mike Tyson. Everybody has a plan until you get punched in the face. And that's what being a CEO is like. You're going to get hit. And you can have the best plan, but once you get hit, everything changes. So you got to have the people around you that can support you and help reorient the company to be a success.
Beautiful. What is one book that inspires you professionally?
Oh, that's a great question. I'm a big science fiction fan, so it's not actually the best from a straight analogy perspective, but I've been a big fan of Ender's Game. So this is a book by Orson Scott Card, and it's about kind of a dystopian future where children are trained to kind of pilot these robots that are out in space fighting an alien bug species. But what I really loved about it is that it really kind of points towards young people as being the future, I think, for a lot of technology. And I think it's really important that young people are allowed and encouraged to kind of develop their skills, but also given opportunities to succeed. Too frequently, I think in my career, possibly because I look very young, I've been, I've had to make my own opportunities. And I really like the idea that, in the future, it's actually, little kids that wind up leading this army to save humanity. It's not the adults. So, there's a lot I think we can learn from books, but I like to think about, the future being in the hands of the youth as being an important part of my thinking.
Beautiful. Can you repeat the author?
I believe it's Ender's Game by Orson Scott Card.
Beautiful, in the show notes.
Yeah.
Your second CEO tip is that the collective mission matters.
Yeah, so this goes back to the people. There really is, I think, an important, component to any organization about having a shared mission and shared vision. And this, I guess, points a little bit to the strategy piece you were talking about. When you have a really powerful mission that everyone is aligned with, it can really make people run through brick walls. So, my first startup, Exonics Therapeutics, was all in the service of finding a way to treat boys with Duchenne muscular dystrophy. So for those of you that don't know, Duchenne dystrophy is a terrible disease. It's X-linked, which means it affects boys because X chromosome and a Y chromosome. So if you have a mutation on the X chromosome, you sometimes don't have another gene on the Y chromosome. And so if you don't have the gene for dystrophin, this is basically a very large protein that acts like a giant shock absorber in your body. So all of your muscles have this protein dystrophin, and they keep your muscles kind of having a truck down the road without shocks from tearing itself apart. If you're in a car without shocks, it's very bumpy, starts to rattle, and the next thing you know, you're flying off the road. So your body kind of works the same way. You really need dystrophin in order for your muscles to act right and to allow you to walk, to allow you to breathe, and even for your heart to beat. So boys with muscular dystrophy, Duchenne dystrophy, eventually will wind up in wheelchairs around age 13, and they lose the ability to breathe because your diaphragm is actually what helps to inflate your lungs muscle. And so either they'll pass away from respiratory failure or from heart failure sometime in their early 20s. So at Exonics, we were trying to actually do in vivo gene editing. So this was taking CRISPR-Cas9, which I'm sure some of you have heard about, and using it to make a therapeutic genetic edit in the boys. And so, this hasn't gotten into the clinic yet, but the animal data we were able to generate in a dog model for Duchenne showed over a 90% correction of the genome and a therapeutic level of protein that we hope will be tremendously impactful. So, when you're able to visit with these patients and these families that have Duchenne dystrophy, you really get a sense of the importance of the work. And at least for me, and I think the others at Exonics, it really inspires you to get up and go to work every day, knowing that there's, real families, real patients, real pain in the world that you can help address. So, when I start a company, I like to start with the people, but I like to make sure we also have a mission that's inspiring. And that really, to me, is the kind of collective vision that can really drive a company to success.
Beautiful. Your third CEO tip is that an entrepreneur should raise more money than she thinks she needs. Why?
So this is something very common in the biotech world, maybe a little bit different. The amount of money you need to get something through, even animal proof of concept into a phase 1 study, but then certainly to a phase 2, a phase 3, tremendous amount of money. I think, there's been studies on this. The cost of developing like a single new drug is over $1 billion. It might even be close to $2 billion now. And so I think when we as entrepreneurs are raising money, there's a tension, right? You don't want to dilute yourself at a low valuation. You want to make sure you're building value over time. And so what that will lead some folks to do, especially in the biotech world, is historically people would try to raise a little money in a seed, a couple $1 million, 10 to 20 million in a Series A, and then hope that you can raise more money later. And what I've found is just that might be too late. I mean, sometimes that works, but the trend in our industry has been to raise 40, 50, sometimes even 100 million in the Series A. And yeah, you as the entrepreneur are going to suffer some dilution there, but it really gives you a great opportunity to explore and to go in a few different directions and not just have to advance the first modality that comes to the top. It gives you a chance to have follow-on programs, to have a pipeline, and to really build this team of great people. It's a very strong labor market in biotech right now, in part driven by COVID. A lot of people are trying to make therapeutics, and there's a lot of money around to do this. So, in my view, it's always better to take more capital than you think you're going to need, just because things always go wrong, and you don't want to be in a position where you're a few $1,000,000 away from a breakthrough, but you don't have the data to raise the next round, and your company might go under. You might not be able to raise capital, or you can get more money, but it's at a down round or a lower valuation. So my view is always have a cushion. Make sure your company always has 18 months of operating runway, and whatever you think you need, you probably want to double it, or at least add another 50% on top.
Especially in funky 2020.
Yeah.
What do you look at when you decide if to invest in a company, and also because you said that you import, what you look at in the founder or in the team?
Yeah, so I mean, I really try to look for people that I'm inspired by. Some of this is how you come across in a presentation, but a lot of it is, the ability to think critically, the ability to show that you have a plan, that you're not shooting from the hip and just saying, "Oh, we'll figure it out later." Plans will change, but if you don't have a plan to start out, it's really hard as an investor to put real money behind that. So I look for people that are inspiring to me. I do love investing in people, but I also look to make sure there's actually something there under the hood. Too frequently, we all fall in love with a story, and it's a little bit of vaporware. I like to make sure there's some substance there as well.
Many early stage founders, they don't know what they should track on the way, which metrics, which KPIs to track. You see a lot in the medical field. What are examples of metrics that works better than others? Early stage.
That's a great question. I guess it depends what you mean in terms of metrics. If I'm talking purely as a financial investor, there's a few boxes you like to see ticked. Is the IP position strong? Do they have a great leadership team? Usually, venture-backed entities tend to do better than non-venture-backed entities. So I look to make sure that there's at least some serious VC money and board members attached to a project. Really want to make sure too that the academic leadership is strong. Scientific advisory boards, as a company matures, you tend to rely less on them, but they're still a really important resource. And so you want to make sure that not just the people that are in the company, but the advisors and the KOLs they're speaking to are strong as well. And then there's just a certain cadence to these companies. You want to have positive news flow kind of coming out on a regular basis. You want to see tractable development towards the clinic, or towards an approval for a drug. And when they get public, obviously that's a great milestone, right? Anytime a company can cross over and go into the public markets, that's wonderful. But really, seeing an ability for the stock to trade up over time is really important, because all of these companies will need to raise more money. And if your stock is depressed and it's, you're already kind of, losing the previous round investors' capital, it's going to be hard to attract new capital. People like to bet on winners. They like to see things that are, making, steady progress in terms of value accretion. So those are some of the things I look for from an investment perspective. From a technology perspective, for me, it's all about solving an unmet medical need. If you're going to be in a small molecule or another, in oncology, we have these things called checkpoint inhibitors, so PD-1, PD-L1. So it's a famous discovery about a decade ago, led to the development of these drugs, and then there was a flood of Me Too products. So that's never really been that exciting to me. If you're the fifth or sixth Me Too product to market, I think it's really hard to succeed that way. So that's one of the big red flags I have. How differentiated is your technology, and where's the niche you want to play in? How are you really going to demonstrate to the market that you're solving a need that no one else has? So that to me is the real important thing. Is what's the unmet med, and how are you different from your competitors?
What did you recently change your mind about?
Well, it wasn't recently, but COVID, I guess would be the big one. I was definitely one of the folks, even though I'm a doctor, who didn't think it was that serious of a disease. It was, in my mind, something like the flu, and it would be something that the world would learn to deal with. And unfortunately, I think the world is going to have to learn to live with it. But it really does appear to be a very serious disease that has many long-term side effects. So I just was reading a study this morning about the long-term cardiovascular complications for patients with COVID, and it's really scary. I mean, there's a huge, I think, lack of understanding with some people, especially in the United States where I live, about the long-term health effects here. And you see a lot of people putting themselves at risk, putting their loved ones at risk, and no one knows what you might be able to recover from the initial infection, but there really could be long-term consequences here. So it's something I really encourage everyone to take seriously, and to take as many precautions as you can, from a social distance perspective, from a mask perspective. Really think about it, because it's not the case that this is something that you have and then you're fine after. It really could be something that causes real problems later in life.
What are trends in the therapeutics and medical field that make you excited, that are emerging?
Yeah, so for me, it really comes back to the genetic medicine concept. Being able to use gene therapies to deliver a permanent cure, or in my view, the future for all of us is gene editing. And I know it's very scary to say that, but it's the most powerful technology, and we're just in the early stages, infancy of figuring out how to use gene editing, just for ex vivo therapies. So right now, most of the companies are taking cells and they're editing the cells outside of the body and then administering the cells as a therapy. But I believe in the future we will all, welcome an opportunity to have our DNA edited to prevent things like heart disease and cancer, maybe for forever. I mean, you could envision a world where you can correct people's DNA and enable the 200-year lifespan you were talking about earlier. So that to me is the most exciting trend. There's a lot of work to be done. I think some of this won't happen even in our lifetimes, but there's no question in my mind that the human species will develop this capability at some point. And I think it's going to be a game changer for humanity.
What's your take about, my kids are too old, so I was too late. And in Europe, everybody that I know is too late. We are not aware enough about the new technologies and what you can do if you think early enough to conserve some parts of the birth process. Mm-hmm. Because in the US, if I follow people like Peter Diamandis, etc., and they are all like, "Oh yes, people, this is it. This is what you need to keep." And then you can regenerate parts of your kids. Later on, they can regenerate parts. But in Europe, nobody seems to care and nobody seems to act upon it yet. I tell some friends who are having kids right now, but the awareness is low. What's your take?
Yeah, I mean, it's an interesting question. So I think what you're referring to is saving the placenta or the umbilical cords when children are born. I'll be perfectly transparent. I have 3 kids. The first 2 were born in New York City, and I declined to save their umbilical cords. I'm pretty confident when you decline, the hospitals still can use those materials for research purposes. But for my daughter, who was born here in Massachusetts, I did pay to keep her umbilical cord. So, I think it's a really interesting question. There are real benefits to working with umbilical cord cell tissue. They are more fetal-like, and obviously, if it's not going to help me or my 2 boys, but for my daughter, these cells are perfectly matched to her from an immune perspective. So, if you could figure out a way to make a new tissue or organ from them, then you wouldn't need immunosuppressive drugs to transplant that into her. So there is real, I think, reason to maybe want to bank some of these cords for future use. It is, not terribly expensive, but it is kind of an ongoing expense. And so it's not great, I think, for the world writ large, but it's something I think people should think about. I tend to believe that, the combination of gene editing that I talked about, and then this induced pluripotent stem cell technology, it should solve it for most people. Induced pluripotent stem cells in an adult cell, so you can take skin from a patient, older person even, and use a combination of growth factors to push that cell back towards a stem cell state. So even though you don't have the umbilical cord stem cells, you can still make something that looks like an adult pluripotent stem cell, even from a skin cell or an older cell in your body. So I think as that technology matures, hopefully for those of us who weren't so lucky to bank our cord blood material, that should offer an opportunity, I think, to make the same types of innovations that you could get from an umbilical cord. So I agree where we are right now. Umbilical cord cells are easier to use, but I think in the future, the combination of gene editing plus iPSC should enable all of us to benefit from those types of therapies.
Are there books about this argument that you can recommend because they are, let's say, readable and easily digestible?
That's a good question. To be perfectly honest, I read a lot of scientific journals. I have not been reading a lot of books in this space. I know George Church, I believe, wrote a book on gene editing. I forget what it was called recently. He's got this, this idea that you could use gene editing to bring back species that have gone extinct, like the woolly mammoth. So it might have even been called mammoth. I can't remember at the moment. But he's a fantastic, I think, ambassador for gene editing. He's one of the, one of the folks who gets credit for discovering CRISPR-Cas9. And he tends, when I've heard him speak at least, to be really able to communicate, I think, to lay people and explain the science in a way that's understandable. A lot of what I think, my insights are from is really just synthesizing lots of information across, many companies I'm working with, as well as many scientific journals. So these are all my opinions. I wouldn't I wouldn't tell anyone that these are all facts. It's just my view of the space right now. But that's a great question. Let me think on that. I'll try to get you some names. We can put it in the.
Beautiful.
Yeah.
Who should be my next guest?
Oh, that's a great question. I would really try to work with someone who's in this kind of, next generation gene editing, but really on the cutting edge of translating this into a tractable kind of technology. So one of the companies that we've invested in at Bayer Leaps is called eGenesis. And the CEO there, Paul Secri, is a great guy. So this is another company that George Church is a part of, and they are taking the approach of editing pigs so that their organs are transplantable into humans. And I know it's a bit of an ethical kind of conversation, but you look at the unmet need for organ transplants. So many patients die every year on dialysis because they can't get kidneys. And so I think what these guys doing is really transformational. They're really not that far away from having the ability to transplant an organ from a pig and potentially save a patient's life. And I think that is a really cool application of this technology that really just scratches at the surface of what's possible, but it's achievable within the 5 or 10 years.
Beautiful. Thank you so much, Jack, for being on the show. And thanks everybody for